Hi, my name is Megan Leach. Today is 6/22/2021, and today I'm going to be doing the pharmacology and career video project. Specifically, I'm going to be looking up, I'm going to be discussing the role of a physician assistant. And I research what they do, everything, all those questions and everything. And then additionally, one of my friends who is currently in PA school answered some questions for me as well. So some of this information is a mixture from research and also from a over-the-phone interview with her. She currently lives in Georgia, so we're not able to do a video because of that. So to begin, what is a PA? So a PA a PA is a medical professional that diagnoses illnesses, develop and manage treatment plans, prescribe medications, and will serve as primary healthcare providers for patients. They also have thousands of hours of medical training, and they're versatile and collaborative. PAs also practice in every single state and every single medical setting, specialty, and improving healthcare access and quality. PAs and physicians are responsible for the patient of the care of the patient, but a PA operates under the advisory and the indirect supervision of a physician. So PAs are always under the advisory of an MD or DO, so a physician, but they do have the credentials to practice as independent providers as well. So what does a PA do? PA-specific duties depend on which setting they work in, their level of experience, their specialty chosen, and state laws. So generally, PAs can take medical histories, conduct physical exams, diagnose and treat illnesses, order and interpret tests, develop treatment plans, prescribe medications, counsel on preventative care, assist in surgeries, make rounds in hospitals and nursing homes, and also do clinical research. Non-clinically, PAs need to have great communication skills with not only with the patient but with the family. Additionally, they need to have communication skills with other providers. Specifically, if they're working under a physician, they need to be able to communicate with the physician, bounce ideas off of them, take advice, be open to constructive criticism. They also need to have open communication with the nursing staff. So in any setting that you work in, you're going to have nursing staff, whether that be nurses, medical aides, PCAs, techs, or just like registration. If you're working in an office, you have people at the front desk. So you need to have open communication with everyone that is working together for the best care of the patient. You also need to have you also need to document. So everything and anything that you do for a patient gets documented. Specifically, like as an example, if someone is in the hospital, anytime that they are given a medication, there needs to be proper documentation, prescribing, everything that goes along with that. You can't just give something without having any documentation of it. So where do PAs work? As I said, they work in every single medical setting. There are over 1,500 PAs, and they work in various different settings. So for some examples, we have hospitals, and this can consist of the many different departments within those hospitals. So some examples, you have the emergency department. You can be a hospitalist working up on the floors. You can be in surgery. You can also be in a PACU or an ACU, so post-op or pre-op. You can also be in outpatient care. There's obviously many other aspects that go along with working in a hospital setting. There's many different departments, but these are some of those main ones. They also can work in medical offices, so that could be as a primary care physician assistant. And that would be like if I were to go to the doctor right now and see my provider. I currently go to a doctor, physician, but there is a physician assistant that works within my office, and I would be able to go to her and receive the exact same care. Community health centers, nursing homes, retail clinics, educational facilities, workplace clinics, and correctional institutions are just a couple more examples. So correctional institutions is actually a big demand for PAs. especially because that there's been less kind of desire to work in those. Next, we look at how do PAs work with a physician. So as I've noted that they work under them, they work under their license, and it involves having an open communication with that physician and being able to bounce ideas off each other, taking constructive criticism. And as it says here, that the PA has to be committed to team practice as well as their physician. Most state laws require that PAs have an agreement with a specific physician in order to practice. And within this method of team practice, it may include consultation of possible treatment plans for patients, assisting physician with treatment, and vice versa, meaning the physician can also assist the physician assistant in treatment. And all of the PAs are overseen by the physician. So with this, something that I've learned from working in the emergency department and working closely with physicians and physician assistants. So in our department, we have one physician on at all times. And then within that, we have 2 to 3 physician assistants. And that can kind of range back and forth from depending on the day. But one thing that I've noticed is that there has to be mutual respect between the two. Physicians really, really, really respect the physician assistants and within the department. What they're doing is they're helping them. They're taking off their workload. They're taking on their own patients. The physicians are there to oversee, but the physician assistants are really putting on that workload and taking care of patients fully. The physician is really just there as like a backup while they're seeing their own patients as well. So education required to become a physician assistant. So you need to have a bachelor's degree. And that could be any 4 or however quick you finish a bachelor's degree, but that it needs to be in any major it can be, but you have to take courses in basic and behavioral sciences as prerequisites in order to get into physician assistant school. So additionally, in order to get into physician assistant school, almost all schools require direct patient contact hours. This is normally ranging from like 200 to, as it says here, over 3,000. This can include paramedics, athletic trainers, medical assistants, techs like I am, or you can even be a nurse. You could anything that involves direct patient contact. So PA school itself is a master's degree level, and they average for about 27 months in length. The first half is known as the didactic phase. This is similar to medical school, where it is set up where the first half you're in the classroom and you're taking courses. These courses involve like medical science, behavioral science, and behavioral ethics. That second half of your schooling is clinical. That's where you get your more than 2,000 hours of clinical rotations upon graduation. These rotations include, but are not limited to, family medicine, OBGYN, pediatrics, general surgery, emergency medicine, and psychiatry. Again, different schools will have additional clinical rotations possibly, but for the most part, every single school has this same basis. So the typical salary of a physician assistant as of 2019 was $1,112, roughly $1,000, according to U.S. News. The range for that was between a little bit around $90,000 to $130,000 a year. It stated that the field of a physician assistant is only growing even more, and with that comes more demands and more than likely higher pays. The schedule of physician assistant, a lot like other health professionals, really depends on the specialty that's chosen. If you're working in an office, you're going to be there from Monday through Friday, possibly 8 to 5. If you're working in a hospital setting, those hours can change from week to week, weekend to weekend. You can work nights, you can be on call. You typically work around like 40 hours a week, but that again can change week to week and can really go about the demand. I know, for example, right now with us, we're a pretty small hospital. Obviously, the demands of COVID-19 has really put a strain on us. So all of the healthcare professionals, including the physicians and physician assistants, have really picked up hours. So they're working well over 40 hours a week, really putting in the time to be there for patients. So medical equipment necessary. This is a big long list, but we'll kind of just go over some of those. So PAs will commonly use a stethoscope, which you see a lot in the medical profession. Blood pressure cuffs, getting temperatures, eye charts to look at the eyes. So here's just a really long compiled list of all the different equipment, but more so the technology in the medical equipment is what is more important. So things that PA needs to have skills or knowledge for the different medical equipment kind of varies from specialty to specialty, but so I kind of base mine upon the ER setting because these are what they use the most. So an EKG machine, one of the most important things, anyone that comes in with any types of chest pain or any type of heart condition immediately gets an EKG. That's one of the most important things. Other things are bladder scanners, ultrasound machines, blood pressure readings, and intubation scope. That's super important for anyone that's getting intubated. You need to be able to use that technology in order to utilize the scope in order to intubate someone. And then skills and knowledge of computers. So this is really regarding for documentation. Documentation, again, can vary from position to position, depending on what setting you're in, can vary for how much you need to document. But for the most part, in any setting, you need to document a decent amount. So license, registration, certificates, and requirements. In Massachusetts, the license requirements to be a PA is to pass the National Commission on Certification of Physician Assistants exam, have a bachelor's degree in any field, and have completed an accredited physician assistant program. You get one through the Board of Registration of Physician Assistants, and you do that through mass.gov. And then from there, your license needs to be renewed every 2 years. So what are some quality and characteristics that you need in order to become a PA? You need to have some interpersonal skills. You need to be able to communicate very well with people at all levels. This can go from children to patients to adults to scared parents to scared husbands and wives, but then also need to be able to communicate professionally with your coworkers, your superiors, and other people within the environment of your work setting. With those communication skills comes the importance of having active listening skills. You need to be able to hear what other people are saying as well and not just speaking to them. Tech savviness, as we said, with the documentation and the computers, but also with like the machines as an EKG machine and a bladder scanner, a ultrasound machine. You need to be able to have intuition. This will then help provide a trusted, honest, and professional opinion. And this really goes two and two with working with the physicians. You need to have knowledge regarding global and cultural issues. You also need to be aware of those global and cultural issues and take those into account when treating for patients. You need to have multitasking skills. There's many times when you'll be doing something, you get pulled into something else. You need to be able to be quick on your feet and be able to prioritize which one comes first and then go from there. A proactive approach is the anticipation that you need to have those anticipations before the mistakes arise, and that if mistakes arise, you need to fix those before they turn into disasters. Punctuality and reliability, positive and energetic and organizational skills. So Allie Jarvis, she is one of my best friends from high school. She is currently at Philadelphia College of Osteopathic Medicine PA program at the Georgia campus. So she's entering her second year, her clinical rotations, which she's very excited about. She attended Simmons College in Boston for a bachelor's degree where she got a biology degree. She worked as a CNA within Boston in a nursing home and also worked in a lab setting at Harvard. Her advice was that she prepare yourself for very long and hard work, very long nights and hard work. And she's very happy with her decision and loves every minute of it. Additional questions. What did I learn from my research? That there's a lot of different aspects of being a PA. You can't just be smart to be a PA. You need to be able to communicate, have those personal skills that not everyone does. You can't just be good in the textbook. Having an understanding of pharmacology and the body system is one of the most important things of being a physician assistant. You work with these every single day, the body systems especially, but also the pharmacology. These meds are what you're giving to people and what you're hearing from people, and prescribing as well. I chose this because I am hoping to enter the physician assistant program soon. Thank you. Have a good one.